So we're going to look at the skull bones today. There's 22 bones in the skull. Now they're fused together. So, you know, we think of the skull as one bone because the bones that make it up are all connected. We don't see gaps between the bones, but there are 22 individual bones that we think about in the skull. So we'll go through this today.
Is it the same as like the skull?
No, this is different. Yeah, now we're just on the skull bones. There's 22 bones and they're connected by sutures. So sutures, they look like stitch marks. You can see some right here. So for a baby and young child, there's cartilage between the sutures. And a soft spot on the baby's head is a part of the cartilage between the two bones that are not joined yet. But as the baby gets older, that closes up. And by age 35, you have completely closed up sutures. So sutures any connection between large bones. And usually it looks like a jagged line, like a puzzle piece that fits together. So that just provides more stability when you have interlocking pieces with jagged lines. You can see in here a few of the main sutures. You have the coronal suture, goes across your skull, sagittal suture, lambdoidal suture. The first bone we'll talk about is the mandible. It's your jawbone. So it's a piece that is held to your skull by ligaments. So on its own, the jawbone can separate from your skull. You can be dislocated because it's not connected bone to bone. It's a ligament that connects the jaw bones to your skull.
How could you dislocate it?
Through injury usually, or even if you just apply a lot of pressure on the skull, like if you sleep the wrong way, that can also do that. Or if you just chew or talk the wrong way, that can also just make it pop. So if your jaw pops, sometimes you might feel where you have to pop it back into place. And so that's just due to misuse or overuse of your jaw. No, sorry. So we have that one down. And there's sinuses within the skull. These are cavities or hollow areas within the bones. So you have several sinuses, and their main job is to create mucus, which lubricates the nose, and also just to make your head a little bit lighter. It also helps give you voice quality. And so having hollow places within your skull makes your voice a little bit deeper and richer. So if you have a stuffy nose, your voice sounds different. And part of the reason why is because your sinuses are closed up and your voice is not going to be as strong and as resonant with the closed up sinuses. It's also why you can get sinus headaches. You know, if this is inflamed or swollen, you're going to get headaches behind your eyes or around your temple area because you have sinuses in those areas. You also have fissures in the skull, and these are wide gaps between the bones. A common fissure is behind your eyes. And that's where your optic nerves goes through into your brain, along with other nerves and blood vessels.
Like the only actual bone we covered is the mandible, right?
Right, yeah. Yeah, so far we're just going through different parts of the skull, but not the bones yet. Fontanelle is a soft spot in the skull. And so that's what a baby soft spot is. It's an area where cartilage is, but the bones themselves are not fused together. So these are the skulls of a baby, and this is the soft spot that we're familiar with on the front part of the head. But as the baby ages, this fills with bone. But you can see between every suture, there's cartilage and there's gaps between them. Just the biggest one is the front part.
So when is a child's skull fully sealed?
Fully sealed, that would be, I think, around preschool age. As far as, you still have some cartilage, but it'd be to the point where it wouldn't be noticeable. Now, where you don't have any gaps at all, that would be when you're age 35. That would be when you have the sutures filled up completely to the point where you can't see it anymore. A few other things to know about bones before going to the actual bone names of the skull. A condyle is a rounded part on the bone. And its purpose is to articulate with other bones. So it's a round area which is meant to fit into grooves of another bone. And then bones also have things called heads and necks. The head of the femur would be this part right here, and the neck would be the area right below that. Meatus is a tunnel in through bone, and the one on the skull that we see is through your ear canal. External acoustic meatus is the name for the bone cavity that makes your ear canal. You can see on here your jawbone, you have a condyle that connects to your skull. And so there's a groove right here, but this is detached. You have a ligament that connects your jawbone to your skull. You don't have an actual bone that connects without any gaps. Then a foramen would be a small hole through the bone, and that allows nerves or vessels to go through the bone. One of them you have on your mandible, it's called the mental foramen, and that allows nerves to move through into your face. The foramen magnum is an area that, it's a large hole in your skull that lets your spinal cord go up to your brain. And then foramen is singular, but foramina is plural. Okay, so let's go through the bones of the skull. So we mentioned the sutures before. The coronal suture right here separates the frontal bone in gold from the parietal bone in green. Temporal bone in orange right here. So when we say your temples, that's what you're pointing to, or that's what you're touching is your temporal bone right here above your ear. And then your bone in the back of your head, occipital bone in brown. The squamous suture right here separates the temporal bone from the parietal bone. Lambdoid suture back here separates occipital bone from the parietal bone. And then down here you have the styloid process and the mastoid process. That connects muscles to your jaw so you can chew. That's where your ear canal would be. Zygomatic bone, that creates your cheekbones. Maxilla, your upper mouth. Nasal bone. And so then you have cartilage right here that creates the rest of your nose. Lacrimal bone. So do you know what lacrimal means? It's a Latin word. Yeah, that's right, crying. So that's where your tear ducts are. So that's a canal for your tear ducts to form. Ethmoid bone, you can't really see much of it in here, but it creates your nasal septum, which divides your nose into two nostrils. So you're going to see more of it if you're looking at the front part. Sphenoid bone, that creates the back part of your eyes and part of your nasal cavity too. So a few of these bones like ethmoid and sphenoid, you can't see much on the side, but you'll see more when we look at it inside and on the front. Alveolar processes, that creates the gaps for your teeth to come in. So the front view, you can see more of the sphenoid. So you can see it right here. It creates the back part of your eyes. It goes down behind your nose. Nasal bone right here creates the ridge. Vomer, this bottom part right here. So your nasal septum would be this dividing line between your two nostrils. You can see that the ethmoid bone in orange right here creates the top part of it. And then the vomer creates this bottom part right here. Everything else we already talked about. Lacrimal bones in the sides right here. Superior orbital fissure. So that's the nerves that go back into your head from your eyes. The back part of your skull, you can see. So lambda, remember the Greek letter lambda? It's an upside down Y. You can kind of see it makes a Y symbol. That's why it's called lambdoid suture. So inside, if you cut the skull in half lengthwise, and you're looking from the top of it, this right here, this hole is from the brain. Your spinal cord goes through this area. So your brain rests on top of this place. The pituitary gland right here sits on top of this bone right here, the sella turcica. Foramen ovale, so nerves go through from your brain down into your face, and that gives you nerves on the front part of your face for chewing and for sensing. Sphenoid bone, you can see it in better view, and here it looks like a butterfly, and that creates part of your nose and behind your eyes. And then up here, this area, this is where your nose actually is, where you're in the nerves from your nose. So all these little dots right here are nerve fibers that go into your nose to give you smell. So ethmoid bone, two parts of it would be the cribriform plate, which is this area out here, and the crista galli, which is the middle part. So crista galli, that's Latin for rooster's crest. And that's what this top part is right here, because it kind of looks like that. Looking at the other way, so this is now looking downward, upward from the skull. Roof of your mouth right here, you have a hard palate. That's called the palatine bone. And then an indenture right here, incisive fossa. That's where nerves and blood vessels are, and they move throughout your roof of your mouth. The ulnar you can see right here, that creates the bottom part of your nose. Mandibular fossa, that's just a attachment point to muscles. Styloid process, the same thing. Gone through everything else on here. Jugular foramen, that is an opening for your jugular vein that goes down your neck. And carotid canal, the same thing. A carotid artery goes down through your neck through that opening. Sinuses, I think we already talked about that one before, but you can see you have a frontal sinus. That's along your frontal bone. Ethmoid sinus goes along your ethmoid bone. Sphenoidal sinus. So the names are all from the bones that they're around. And then maxillary sinus along your maxilla. So ethmoid, you can see it behind your eyes. Sphenoid, a little bit further behind near your temples. So we talked about processes, and it's just any projection from a bone. So anything that juts out of the bone is a process. Okay, so write that one down. Okay, so there's 8 cranial bones that we'll talk about, and there's facial bones too that we'll go through. But the 8 cranial bones, we've already gone through the names of them, but these are the ones that enclose and protect the brain. The first one is frontal bone along your forehead, parietal bones behind your frontal bone, occipital bone on the base of your skull, temporal bones, oh, sorry. Everybody have those ones down. And then 5th and the 6th one, say the sphenoid bone and ethmoid bone. So that's 6 names, but there's 8 bones because the parietal bones and temporal bones count as 2. You have 2 halves of both of those ones. And then the facial skeleton, maxilla right here in yellow. Palatine bones make the roof of your mouth. Zygomatic bones in green make your cheekbones. Lacrimal bones in blue right here. Nasal bones. And the vomer is in red in this picture. You can see how it looks. It just is the bottom part of your nose, and it divides your nose into two halves. It makes it the bottom part of your nasal septum. Inferior nasal concha. So those would be these curls right here that you see in the bones. So that creates your sinuses and ridges within your sinuses to allow more surface area. And you can see on here, the inside of your nose, the ridges that you get from the bones. And that helps keep mucus in so that it keeps your skin from drying out and allows more surface area. Mandible, your jawbone. So that's all 22 bones of the skull. And for the next few days, we're going to just go through those. So I'm going to give you a few worksheets. And you each get your own little skull that you're going to paint and keep to help you memorize the bones. So again, stop this and I'll hand out some worksheets for you to do today.